and welcome to the quiz show. I am your host, Jordan Jones, and now let's go and meet our contestants. There one, we have Sam, and Sam's there too. We have Brandon. Alright, Sam, let's start with you. What category would you like to pick?
I'll choose general anatomy for 100.
That's a good one.
What bone is broken?
It looks like the femur.
Kind of an easy one.
Yeah, you think so? Alright, Brandon, what category would you like to be picked?
Let me go with disease description and definition for 200.
Perfect. What is the definition and description of acute myeloid leukemia?
I don't know.
You don't know.
I know.
The definition for acute myeloid leukemia is an aggressive disease in which too many immature white blood cells are found within bone marrow and blood. To describe it, it's the most common acute leukemia in adults, as it can arise from hematological disorders as consequence of prior radiation therapy from other cancers, causing high cell destruction, elevated uric acid, and occasionally renal failure.
You got femur?
All right, Sam, back to you. What question would you like?
I'll take general anatomy for 200.
Awesome. How many cervical vertebrae do we have?
Is it 8, 6, 7?
7! Cervical vertebrae is the correct answer. Now, Brandon, back to you.
Clinical presentations for 100.
Awesome. So, what are the clinical signs that could be presented on a patient with acute myeloid leukemia?
Leukemia again. Is that the right question?
Yep, that is the
So
question.
I heard it right. Okay. Fever.
Are you sure?
No.
No? Huh.
Did you pay him?
Super easy. Super easy.
If a patient walks into your clinic, their physical signs can include pallor, fatigue, weakness, palpitations, and dyspnea following any type of exertion. Patients may also undergo clinical signs or anemia, neutropenia, and thrombocytopenia. Pretty easy question.
You got 7.
Super easy. Come on, Brandon.
I mean,
I would have guessed that.
all right, Sam, back to you. What would you like to be picked?
I'll choose general anatomy for 400.
Beautiful. So, true or false, do we have cranial nerves?
Yes.
I feel as
Yes.
if there's some
Yes,
confusion
that
going
is
on.
correct. We absolutely do have cranial nerves. Okay, Brandon, your turn.
Let's go with definition description again. Let's do 400.
400. Okay, question. What is the pathogenesis for acute myeloid leukemia? And be quick about it.
That it almost doesn't pertain to definition or description of a disease, but
That's the question.
no hints for me, I suppose. Pass, I guess.
Causes can vary, but can include an accumulation of malignant, poorly differentiated myeloid cells within bone marrow or peripheral blood, abnormal proliferation and differentiation of a colonial population of myeloid stem cells, genetic mutations such as chromosomal rearrangement, and molecular changes.
Are you sure that these are the right questions for me? Because I feel like mine are a little more difficult or too much about acute
Maybe
myeloid
you're just
leukemia.
choosing the wrong categories for your own mindset,
Let me
but
see.
we can check the questions for you.
I would love some
Okay.
sort of.
Well, we will be back after this commercial break. Stay tuned.
Are you a former cancer patient experiencing physical signs of weakness, fatigue, paleness, or shortness of breath following any type of exertion? If so, you may be experiencing symptoms of acute myeloid leukemia. Risk factors for acute myeloid leukemia include smoking, genetic history of cancer, as well as chemotherapy and radiation exposure. Acute myeloid leukemia is a cancer found in bone marrow and blood. Though leukemia is very rare, AML is the most common type of leukemia, affecting nearly 20,000 people in the United States yearly. Some red flags or reasons for referral to your primary care provider associated with acute myeloid leukemia include swelling in the liver and spleen, groin, lymph nodes, and leukemic cells and petechia. This ad is brought to you by the Midwestern University SBT1s.
And we're back. So, contestants, this is our bonus round. So, whoever answers first ends up getting the points. Sound good to everybody?
Sounds good.
Sure.
Awesome. So, question is, how would the following physical therapy techniques affect someone diagnosed with acute myeloid leukemia? The techniques being aerobic training, strength training, pain management, stretching, and balance.
I got it.
You know it.
So easy. Come on, Brandon. Super easy.
What?
Let's see.
Alright.
So, it will reduce fatigue, distress, anxiety, and depressive status. It will improve and maintain immobilization for bed rest. It will help improve balance, and it will improve cardiorespiratory endurance.
Even look at, she has a whiteboard with the answers on there, and that's allowed?
Yeah.
I hate the player.
Yeah, I mean, she answered the question correctly. It didn't look like you even looked at the cards for it.
Dazzle.
So, that's correct, Sam. You get the points. Awesome.
Woohoo.
Sam, you are up next. So, what category would you like to pick?
Let's keep going with general anatomy. I'll choose general anatomy for 600.
Awesome. What is your favorite color?
Alright, that's not even related to that. It's a big space.
And you have a problem?
It's my turn, sir. So
Sorry,
we're just gonna.
sorry.
It's going to be green.
Sounds good to me. I love that answer. Awesome. All right, Brandon.
I feel like as if I'm a burden on this show at some point.
It's okay.
Let's go medical management for 100.
Awesome. So, what is the proper medical management of acute myeloid leukemia?
What a shocking question. Probably chemo of some sort.
You are wrong, Brandon. Treatments for acute myeloid leukemia can vary based on the subtypes and the cytogenetics of the AML the patient experiences. But initially, patients are treated with an aggressive combination of chemotherapy to eradicate neoplastic cells and restore normal hematopoiesis. This is normally followed by a constellation of chemotherapy administered in 3 to 4 treatments through remission.
That answer took you 26 seconds. How was I supposed to know that?
Just gotta know it. You just gotta know it.
We do
You
give
came on a
you
game show.
cards, sir. Like
Well,
information cards, like random fact cards.
let's just finish this already then.
Yeah.
That's like, it's not gonna go that way.
All right, Sam, back to you.
Alright. I'm gonna take a guess. There's
Probably
four
general
questions.
anatomy, I would assume.
Yeah. I'll take general anatomy for 1,000, please.
Perfect. Would you like 1,000 points?
Heck yeah.
Awesome. Take them.
That's the question.
Woo!
It's not even the question.
Sir, it was the question. It was.
Alright.
Don't hate the player.
So
All right. All right. And you? Oh, would you like Brandon?
I don't know. Pick one for me.
Well, let's do medical diagnostic processes and for 200 for
Why
you.
not?
So, question: do you just want to win the game? Wait, that's wrong. That's not for you. That's for Sam. That's for the other contestant.
That lines up.
So your question is, what would be the proper medical diagnostic process for someone diagnosed with acute myeloid leukemia would follow?
That makes sense. Okay. If you want to just enlighten me,
Well-
it's not gonna. I don't.
Sounds good. Looks like somebody didn't read the cards, kids. So, a patient would go through numerous tests such as blood tests for total blood cell count, focusing on immature white blood cells, bone marrow tests, lumbar punctures only if the leukemia has spread to the brain or spinal cord, imaging tests such as CT or ultrasound, gene tests such as cytogenic analysis, FISH, or PCR. Well, that looks to be all, and it looks like Sam is our winner today!